Уважаемые участники Гайдарского форума,
Dear participants of the Gaidar Forum, I'm glad to welcome all of you here. We're starting our discussion dedicated to one of the most topical problems for today. This is the one of the healthcare, and in the upcoming hour and a half, along with the experts and panelists, we'll try to discuss in a full manner how by 2030 we can achieve the lifespan of 78 years of healthy life. The pandemic brought us back, and in the upcoming years we'll have to dedicate more efforts to that and accelerate our move. These are the questions which concern everyone in Russia. These are the questions for convincing people, changing the attitude to healthcare, how to proceed from reactive to proactive healthcare, that people really take care of their health, and what we have to change in the system in order to make sure that this happens. This includes the questions of infrastructure, upgrading the financial model, telemedicine, accessibility, and a whole range of questions that we'll try to discuss in the upcoming 90 minutes. To start with, to trigger the discussion, I'd like to share some of my thoughts. I will introduce our participants, and along with that, I will ask every panelist to make several wishes to Father Frost, and take this opportunity to wish you happy, old-style New Year. Let me introduce the participants, and I give you 30 seconds or 60 seconds to make your wish to Father Frost or Santa Claus. And along with that, you can say something in your personal capacity, or you may pick it up from the previous speakers. Let's start. We'll start with the First Deputy Minister of Health of the Russian Federation, Mr. Zelensky. Vladimir, over to you.
Vladimir, спасибо.
Thank you so much, Mr. Soloviev. Also, I wish you happy old-style New Year, all the holidays. Actually, I have two global wishes to Father Frost. First of all, I wish everyone to stay healthy and to feel healthy, because you may have different diagnoses, but at the same time, you may live a happy life. But my second wish, I would ask Father Frost to erase all possible barriers within the healthcare system, between all the stakeholders in the system, between the patients and doctors, between the organizers and principal doctors, between insurance companies and the state. We all have to work as one team, and we have to be interested in the common result, otherwise we will be a failure. You cannot make anyone achieve a result. This will not work. We have to work all together to achieve that result. This is my main wish, that all these barriers between all the stakeholders are lifted. This is what I mean, and that we all work as one team. Yes, starting with patients, for whose sake the system is set up, and ending with the managers who are running that system. Thank you. Our next speaker is Governor of Perm, Mr. Makhonin. Over to you. Hello, everyone. What I'd like to wish, my wish, I would like to ask Father Frost just to be serious. Our public opinion polls show that out of all the issues and problems, which traditionally include the roads and housing and utilities, the residents of Perm territory usually highlight the problems related to healthcare. About 50–60% of people are dissatisfied with the health system, so it means that this is the area that we have to focus on altogether, the federal authorities, the local authorities, and we have to dedicate all our efforts to this issue. And I hope that our today's discussion will make sure that we feel some solutions, helping us to reduce the share of disenfranchised people. More and more residents of the region, of the country in general, should trust the healthcare, doctors, and there should be more and more people satisfied with the services that we provide. Thank you so much. Thank you. Next speaker, Sergey Notov, president of MedInvestGroup. Thank you so much, Mr. Soloviev. Really, to follow what the previous speaker said, I would like to pick it up from the share of people dissatisfied. We have to retain the population of the Russian Federation. Mr. Lomonosov said that population is the only source of sovereignty of the country, and Article 3 of the Constitution reiterated that. But we have to bet on the accessibility of the healthcare system, and infrastructure is part and parcel of that problem. So the equipment in the Russian Federation is worn out more than 44%, speaking about digitalization, exemplified by several regions. So we are short of the infrastructure, and if we do not address these three factors, we'll not actually come up with the accessibility of the healthcare, which translates into a healthy lifestyle. But certainly we cannot avoid the question of money, where we do take money in order to set up necessary infrastructure. According to the preliminary assessment done by MedInvestGroup along with Sberbank, in order to reach the benchmark of the best practices, we need 1.5 trillion rubles in the upcoming 3 years. If we do not do that, we will not keep our population intact, and we will not provide for the accessibility. 1.5 trillion all in all, a lump sum were actually in a year. Well, in a year's time. So it means that Father Frost has to give us 4.5 trillion rubles. So our next speaker is Mr. Farrakhov, Deputy of the State Duma of the Federal Assembly of the Russian Federation. Over to you. Dear friends, Mr. Soloviev, you absolutely correctly spoke about the main objective that we have to achieve by 2030. And speaking about the gravity and complexity of the goals which were put forward by the President, this is one of the most difficult, hardest goals that we're facing, and therefore we realize that this is not something that we can solve money-wise, by means of money. And I liked it very much what Mr. Zelensky said. Let us erase, let us lift the barriers. This is an absolutely right idea. Something that will help us to bring together, to consolidate and implement the huge potential of the industry, which we do have now. What I may ask from the Father Frost, certainly, to make competition in the industry fair and transparent, to apply the rules which are enshrined in the federal laws, which will help us to run and manage that industry. Thank you so much. Thank you so much. Mr. Khabirov, head of Republic of Bashkortostan, over to you. Thank you so much. Well, once we're asking something from Father Frost, when we are turning to Father Frost when we cannot solve something on our own, I proceed from the following, but still, I do believe that acting all together, acting concertedly, we can address lots of problems related to healthcare. We can build hospitals, clinics, and we will provide, we will man all these clinics and hospitals with the necessary doctors. We will set up necessary equipment, but there is another problem. How many big hubs, medical hubs and polyclinics we're building? If we do not motivate people to treat their health seriously, we will not be a success, because that's very important objective. We have to convince people to treat their health seriously. So a man is a master of his life, but very often people are very careless about their health. People en masse, so to say, have to be very cautious, very careful about their health. Are there other problems we can solve? This is what I will ask from the Father Frost. Well, the practice shows that it's very difficult to change the convictions of the people. So it can be exemplified by immunization rate. Our next speaker is governor of Ivanovo region, Stanislav Voskresensky. Over to you. Well, I do not believe in magic wands. I'm more believing in meticulous and everyday work. We have to change and transform our healthcare system. So first of all is to improve the lifespan. The second objective is no less important. This is the length of the healthy life. And number three is about the satisfaction of our patients and doctors. Doctors suffer a lot amid the pandemic. And out of the questions which now go beyond the grasp of the mankind, this is the COVID pandemic. So I would like to ask Father Frost to put an end to the pandemic. We all can make necessary conclusions and will work continuously and consistently on transforming our healthcare system. And to conclude our remarks, our introductory round, last but not least, is Denis Protsenko, head physician, City Clinical Hospital number 40. Over to you. I wish you a happy old-style New Year, and New Year is actually marking a leapfrog to reset the healthcare system. All the panelists today spoke about that. I will support all of you, saying that if we are working, feeling no barriers that Vladimir suggested to lift, if we actually work without believing in fairy tales, we'll not need Father Frost. Today's healthcare system doesn't need a facelift to repair, but we have to do a reset. Reset in terms of training, in terms of motivation, in terms of retaining the personnel of the polyclinics and hospitals that we're building. And this is about the technical equipment. New infectious diseases hospitals are now being built that actually they can be reshaped from infectious hospitals into multifaceted clinics. We have to bet on the interests of the patients. We have to sympathize with the patients. And I think that such a trend will help us to move forward. I do believe that all the panelists actually take the same position and act as Father Frost acting on behalf of the healthcare system. Thank you so much, dear friends. Let us start our discussion. We have just an hour and 15 minutes. Everyone will have an opportunity to speak up and to take my questions. And certainly, you can scratch the surface of another problem. So let's agree that after I ask a question to any of you, I would welcome a couple of comments from the colleagues. And if we understand that it's of common interest, we'll arrange a kind of a discussion. But I will keep time so that to make sure that everyone can speak up. My first question would be dedicated to the new culture. Always, healthcare, at least in the previous years, has been aimed at treating people, curing people, but now we speak more about prevention, how to change the people's attitude to their health, not to treat, not to cure, but to preserve, how this culture can be nurtured, what changes are necessary in the healthcare system, because we cannot just tell everyone, folks, you have to monitor your health, not treating, but do more prevention, making regular checkups.
Больше все-таки как-то у людей должно поменяться? Или мы
Should we change the people's mentality, or we have to change something within the system in order to make sure that the mentality of the people changes? My first question goes to Mr. Farrakhov, and you can also complement to what's been said. Well, that's both a fundamental question, and this is another wish to the farther frost. I do believe that this is a very important part and parcel of the system. Vaccination, immunization, and convincing our voters, our constituency. We felt how deep this problem is and how difficult it is to address it.
Вопрос о решении вакцинации подростков, детей.
We will have to address the problem of vaccination of teenagers and children, and many countries actually made that journey quite easily, but in Russia, that's a very difficult question. Speaking about the relevance of the public health and attitude of people towards themselves, towards their health, this is a culture which has to be brought up by the state. Very often you ask a question in one direction the healthcare has to develop. I do believe that this is about investments which have to be made by the government and by the state in general. And this is not just up to the healthcare entities. This is an objective for which we have to use the state-of-the-art technologies. And various decisions have to be taken, raising the minimum wage and changing the food basket. And this is something that the healthcare ministry cannot influence. All the decisions which are being taken have to be taken proceeding from preserving the healthy lifestyle of our citizens. We see that economic problems, the rise in poverty, may result in the burden of diseases, especially the diseases among the children, and that trail can last for quite a while. We have to support everyone who find themselves in a difficult situation. Let me stress it once again that we have good drivers to change that situation. The modern technologies, digitalization, gadgets, the opportunity to solve lots of questions and problems immediately will help us to convince people to preserve people's health, and this is how actually we can make the people's treatment more cost-efficient. What I'm doing, I would like to draw attention to. Sometimes we are a little bit late. We spoke about the law on telemedicine. And we discussed that for quite a while, but I do think that we adopted that law later than it has had to be adopted. We spoke about the online sales of drugs and medicine, and again, that law was adopted with some postponement. I think that we have to expedite the adoption of certain laws, and these laws would determine the further development of the industry at a more rapid pace. If I may, as far as actually we discussed that topic altogether, raising our wishes, I do believe that the state, in that sense, has to make sure that it would be beneficial, advantageous, profitable to stay healthy. We have to offer some incentives money-wise. For instance, if a person is not ill, then he has actually to get better pension. First thing we have to think about is the motivation. We have to offer new drivers, new motivation. So once this motivation is supported by some incentives, some money incentives, these would be more efficient. And the second thing we have to bet on is that the people have to be protected against what is hazardous.
Alcohol is harmful, so we must think how to protect them from this. So tobacco smoking is harmful, salt is harmful, too much fat is harmful, and we need to think how to protect people. We should work in the field of propaganda and in the intellectual sphere. If we together do something here, it would be a solution for this task. You see, people in this country disbelieve propaganda mostly. I remember I tried to explain to my relatives that sugar is more harmful for health than fat, and there is a film about an Australian who lived on fast food for a whole summer, and he also did yoga, and he remained in very good health. And so when I have shown it to my relatives, they believed me. This cut on sugar. But are there any experiments or are there any statistical data to show that young people are more concerned with their health? You see, I would like to call your attention to the following circumstance. If we evaluate the factors which affect the health of the nation, so the hospitals and other medical facilities, medical services changed by 20 to 25%. And the most important factors are those of culture of the population of the Russian Federation. And if we want to change it, to exert influence on it, then we must instill these values immediately. Culture is the most difficult thing to change. These are education in processes in schools, promotion of sports and a healthy lifestyle. Unless we do that, we will get more and more burden on the system of health protection. So in 2010, we had 23% of people who cannot work, then it was 26%, and up it went. So the system that we have, the infrastructure, the technology, the doctors, the medical personnel, is really under great pressure. It can hardly go on like this. And so unless we instill these values in children, we will have to invest more and more money in doctors and medical infrastructure, unfortunately. Thank you. Anyone else would like to say something? To continue the questions and comments that we have heard from Sergey, all countries now experience heavy burden on their health, public health. Even those countries whose culture includes sports, good healthy food, and a healthy lifestyle, and it is inevitable. Public health is the sphere which is being innovated and developed more than anything else. Questions of incentives, material incentives to people to make them healthier have been discussed widely, but it is impossible to make people happy against their will. We need to establish new channels of contacts, perhaps with the employers. We are at a stage when we are losing our population which can work, which of the working age and healthy enough to work. And so we are experiencing a lack of resources. And so without falling into propaganda, we should communicate with people, and it will take a lot of time because these are things which change slowly. We do not have a magic wand. We cannot change things in 2 years, for example. Otherwise, in 15 years, our system will go bankrupt, and it will go on and on. Being in the same direction, the pressure will arise. Well, we haven't answered the question, but like they said in an old joke, we need to go on. So we do need some propaganda, but we do need to do something to make young people think about health. And now let's start talking about treatment. And now I would like to go into the battle. Often people mention the figure that about the infrastructure is 70% already worn out. So if it is on average in 70%, well, it is in Moscow it is much better. So then in other regions it is 90% worn out. Is it a myth or is it real? How accessible is medical assistance in reality? Is this figure true? As a medical doctor, as someone who is in favor of medicine, of evidence-based medicine, I tend to believe research. I think that this figure, 70%, is more mythical than real. And why do I have the right to such a position? Over the last 1 or 2 years, I have been to many regions. I have witnessed openings of new hospitals, of new in the Transbaikalia and other remote regions. I saw new obstetrics and first aid centers. Yes, we did have a conference in the Republic of Bashkortostan, and we discussed several new hospitals which have just been built in various regions, taken as an example the project that has already been put into practice. So speaking about wearing out of physical infrastructure is something to be discussed. But as we have seen on our visits, we saw that in the Russian Federation, the system of public health is very different in different regions. So it is impossible to make one a law for one legal act for all the regions to improve their health system. But there are some very interesting things which you can find in various regions. For example, a floating outpatient clinic in Yugra, a century chain in Transbaikalia, and there are some other things. And we should not forget also about the telemedicine, remote medical assistance, etc. We should not forget about similar things. We are talking now more not about the material aspect, but about who is responsible to put decisions into practice. And the shortage of personnel is the most acute problem. Both we should change the system of education of doctors. Our modern system has been inherited from the last century, and it has not been dynamic enough. And by way of winding up, I would say that the most popular profession nowadays, which young people choose, is medicine. 31% choose it, and so this gives us some hope and makes us more optimistic. We can hope that this popular profession choice will help us to solve the problem of shortage of personnel. I would like to thank our colleagues who work in the medical system directly with patients, especially in the countryside. It's a titanic labor. I would like to thank our colleagues. Alexandra Nikolaevich, I would like to say the following. We have here half of us are governors of regions. Would you like to add a few words? Well, as Mr. Protsenko has said, we should not make one-size-fits-all model of health for the country, because in Moscow the conditions are different from those in the Far East or, for example, in the Caucasus. So we need a set of model decisions, but they should take into account the variety of our country. From Kaliningrad to Sakhalin, we have different traditions, and we should take into account also cultural traditions in medical services. It's very important. So, as they say, think locally, think globally, act locally. But we should think locally, after all, so that we could have some Lego set which could be used in various regions. Well, we should work not for the sake of the process, but for the result, for our patient. I do not want to use the word patient-oriented. Our system must be patient-centered and not patient-oriented. And those regional differences, regions and variations should exist in a system of the same paradigm of values, both for patients and for doctors. So, Dmitry Nikolaevich, the only thing that I would like to add, I totally agree that we have different regions, and the difference is not only that of density of population, but also of morbidity. For example, in the Perm region, we emphasize fighting those causes of death that are most widespread. In Perm, we have a lot of cancer. We have environmental problems which have not yet been fully resolved. We're an industrial region, so we have cancer. We have also cardiovascular disease, and we have a 3-tier system. There are in district hospitals so that people could get the same treatment where they live, and high-tech assistance in larger cities. And that is our approach, and we hope that based on the results of last year, having created this 3-tier system, we will get good results. And we need also flexible tariffs of medical insurance fund, and this is a big problem which I, as the head of a region, to solve, so that regions would be more flexible. Ray Farid, I would like to ask you after what you have said, connected with the primary tier. A lot is being said about this tier and the approaches. I know that you have a regional program of transformation. Can you comment on it? Thank you very much. I have 2 or 3 minutes, yes? Oh, yes, you do. You do have them. But first, what we are discussing here, perhaps I'm over-optimistic, but I believe that our health system has a unique chance right now, the chance to get a high quality, very much high-quality industry, which is very much in demand. On the one hand, the COVID pandemic has been a great blow. We lost people, we lost our relatives, etc. But it has shown to us that without medicine, we can go extinct. So, as regards the primary tier of medical assistance, when I started working 3 years ago, visiting our local obstetrics and health assistance centers, and they are often located in some exotic premises, and a very large part of our population lives in the countryside, in villages. And in one district, the local health center was a former barracks used to house German prisoners of war after the Second World War. there are some others very old premises for local health centers, and so we need to invest more funds in it. We should rebuild such places. When people get ill, they go either to a local health center or to an outpatient clinic, and that's their first meeting with public health. So we can say, thank you, President. A very good program of modernization of public health has been adopted. 18 billion rubles have been allocated to our republic for this purpose. It is a lot. We will build several dozens new outpatient clinics and health centers, and so it is very important to pay attention to the material resources of such clinics and centers. We have built very good perinatal centers or some specialized clinics, but we need to invest in ordinary first-tier medical facilities. And the pandemic has shown that we need new approaches and new construction solutions. So you can build a health center in the countryside for 2 years or for 2 months or etc. So we should think how we should do that, how we can do this quickly and with good quality so that it would be warmer in those health centers and clinics, etc. And now we are solving problems as they come up, but we need a strategy to act in advance. If Ross Health Inspection Service does not tell us, we do not check and solve our problems. And many health centers in our republic do not meet the necessary requirements. And here we need to resolve this problem, but that takes money. And of course, there is a shortage of personnel. I totally agree with Denis Nikolaevich. We can say a lot about that. And as the Roman Center said, Carthage must be destroyed. I have a positive approach. For example, our medical university had quite a lot of medical students. And if they all worked in the health system of the Republic, in outpatient clinics and in other places, we wouldn't have any shortage. But where are these doctors? We tried to find out. I'm not sure if this is unique for our republic. Quite a lot, in fact, lots and lots of former medical students do not work as medical specialists. They changed their profession. So we should take into account those people who are ready to work as in medicine. I am talking about college leavers, medical college leavers. These are usually students from poor families, and it is difficult for them to get into any university, and they should be given access. Those who have worked as a nurse, as, for example, as someone in some paramedic, they will never leave medicine. They will always work in medicine, and they should be allowed to get. They should get an opportunity to get into a university. My colleagues, the governors, would agree with me. We give money. We give millions of rubles so that they go to work in the countryside. So they go to work for 3 years in a village. They work lots of money. Then 3 years after, they go to another village and again get them lump sum of money, and so on. I do not have any ready-made solutions for this problem, but I think that we should pay attention to medical college leavers. May I interrupt? I'm a bit surprised. So, So medical students do not work as as doctors, but well, what profession do they choose? Well, economists or whatever. I tried to find out why they do not want to work as doctors. For example, a boy or a girl finishes school and their parents are doctors. And so they send the child to the university. But not all of them are really good doctors. So they do not work as doctors after university. And some go to work in private clinics.
We have to address that problem separately so that we could actually ensure that we have necessary dentists in the rural areas. You cannot find a dentist for children in the rural area. Number 3, sadly, again, the pandemic gives us a unique opportunity to test new technologies and to understand the value of the new technologies. Do I still have time? When we had a peak of morbidity last autumn, we realized that people have to get the source of information there, where we set up an information center. Actually, having about 100 people in the call center, the leading fellows of our medical university had to stay around the clock there, and they would address about 30% of all the questions in these call centers. This is not about telemedicine, but still everything related to remote consulting and artificial intelligence and telemedicine. These are the things which have to be implemented and applied. What we again did, actually, 1,080 medical hubs are connected to internet, and for instance, if you have to turn to a cardio center, you will get your X-ray pictures almost immediately. What Stanislav said, the regions are different, and our region is quite huge, and not just to make people going from one center to another. This is what we can address by means of telemedicine. We try to address that within 6 months. For instance, a person comes to a primary doctor and how to execute a sick leave. So a sick leave is administered by a doctor. So you have just again to do that by means of a digital channel, not to make a person going from a rural area to some city where the sick leave would be executed. So there are lots of nuances which can be addressed by means of these digital channels and new solutions. But let me stress once again that when we analyze, and to conclude my remarks, speak about the telemedicine, we now get a unique opportunity to become stronger and to make our doctors work better. Colleagues, can you share some best practices or best cases? Well, there are 2 things I would like to share. First of all, I'd like to support what's been said, that we have to be flexible. And my request goes to the federal authorities in terms of the standards, how we build schools, how we build hospitals. I know some work has been done by the communal industry and construction ministry, how the hospitals and schools and other structures can be erected from wood, and wooden buildings where everything is rotten, but building a hospital or building a school out of wood is made of wood actually is not possible. For instance, we can use some very strong types of wood, but it is not possible due to these standards. I also turn to the federal healthcare ministry. We speak about the shortage of doctors, but for instance, actually I cannot go to a medical college if I have only 9 grades of education, so I have to leave to finish the high school to do that. Secondly, For instance, if I worked as a paramedic for several years, and if I want to become a doctor, I have to actually get training for several years. But I know something about the medicine. I do think that we can offer some facilitated courses or some shortcut courses to make sure that the paramedics become a doctor. These problems prevent us from setting up necessary infrastructure and addressing the shortage of doctors. Proceeding to the model, there is a churn of doctors and outflow of doctors. Some programs are not efficient in the sense that we are lacking funding. Let me interrupt you. I'll analyze the balance of outflow of doctors from my region to your region, actually. So it's equal, meaning that outflow equals the inflow of doctors. Well, quite recently, in my home city, a hospital was built, and a residential house was built, and a family of doctors moved back to that city just to live, as they were often the housing. We have to create necessary opportunities for our school leavers that they opt for becoming doctors. We have to support them with insured and guaranteed enrollment in Perm region again, proceeding from the fact that we need high points on the unified state exam, and many people go to the federal centers to enter universities, medical universities. But for instance, last year we offered 1,500 places in our technical vocational schools. But we need more such seats, more such places. Well, back to this you score 10 to 10. What we ran into that was a very posh program, a very efficient program, a rural paramedic, a rural doctor. So it works very well, but we have to reset it. And working to the colleagues in the field, we see that it would be even more important not just to get another million of rubles, but we need some efficient programs, social infrastructure, housing. These are the things which will allow us to retain doctors in the rural areas, in the primary healthcare system. That's very important for the lawmakers and for the executive authority. This is another part of that program. Stanislav, I think that you wanted to add something to what's been said. Well, let me make a comment, not just complimenting what's been said, or what is more appropriate for you. Look, there is something to comment on, and really we are discussing that in the council, and the primary healthcare is, I think, is in the front line of the pandemic, fighting against the pandemic, and the president offered $500 billion rubles to totally reshape the primary healthcare system, the equipment, the necessary structures, but now we're discussing how to retain doctors in that system. But we don't have to be shy to attract private investments there. The tariff system today works well that private companies are not very much interested in the primary healthcare system. But actually we have to attract private investments into the mandatory medical insurance system, that it is free for the people, but also quite good for the private companies. As Ms. Golikova said, we have to bet on the high-tech technologies. We have certain opportunities in order to totally reshape the healthcare system. We're a country of good high technologies. We are strong in engineering. Let me draw an example of what we did over the last 2 years in Ivanovo territory. International experts say that in the world you may find a couple of dozens of technological solutions which may result in the rise in the healthy lifespan.
В начале пандемии весной 20
In spring 2020, we used the digital tomographs, working with artificial intelligence, and what it gave us as a result. Actually, before, the full procedure took about 20 minutes, but now it takes only 5 minutes. And you see all the hotbeds of the infection on the pictures, and it made doctors work easier, and we avoided any queues. Due to such an experiment, we made another quasi-telemedicine project. Let me translate into Russian what it means.
Иваново можно
In the city of Ivanovo, for instance, if you call for an ambulance, while the ambulance is going, if it is not top urgent, then you will have an opportunity to talk to a doctor, and 2/3 of people agree to that. For instance, when a person calls an ambulance, actually, it means that something happened, and in 1/3 cases, a person would cancel the call of the ambulance, and we keep track of what is going on next. That this is not a false alarm, that a person would either call ambulance once again or actually would go to a therapist. But what is even more efficient? Such a consultation resulted in calling an ambulance in an emergency case. So a person felt quite well, but decided to talk to a doctor, and the doctor took the decision to speed up the ambulance. Otherwise, a person might die. Every ambulance car is very valuable, and if such telemedicine technology gave us very brilliant result.
в частях первичного звена
In telemedicine and in other primary healthcare system, we try to implement other results. But I'm confident that all colleagues in the regions have a set of such solutions. You offer this or that, and at least we have to bring together all these best practices, and we asked a number of international experts to
если мы это всё реализуем,
get a pack of best practices from all over the world, and it will give us quick wins effect, and it will be good in terms of extending the healthy lifestyle and healthy lifespan. So doctors want to do their job properly, but amid the pandemic, they have so much work to do that we have to help them. And finally, I would like to extend my gratitude to all the doctors. They have a very heavy burden on their shoulders, and thanks to the work of the doctors in Ivanovo and in other regions, we fare quite well through the pandemic. Well, the doctors who are providing the consultation, does it require higher qualification or not? Well, Mr. Soloviev, what we did, it's an open secret, and colleagues would confirm that probably, that there is a churn of doctors who opt for other professions, who move to Moscow, for instance, and we see the shortage of doctors everywhere.
важно уточнять.
Well, medical academies are important, but for instance, the school leavers don't want to become physicians, and this problem is not typical only of Russia. This is a fact,
Говорю,
and this is typical not only of Russia. We have such a shortage, and therefore, for telemedicine, we are using not the local doctors, we're using the federal doctors because we're short of our local
Интересная возможность, кстати, использовать действительно
physicians. Well, certainly,
работать оффлайн, а онлайн при этом готов.
that would be very interesting to resort to the people who don't want to work offline, but who would be eager to work online. Well, this bit of telemedicine shows that the payback is very real. So this project requires some extra investments, but we may save a lot of lives. And the people would cancel their call off for ambulance, which is good. well, do you see any resistance among the people?
Как человек привык, ты пришел к терапевту,
Well,
диспетчер тебя пам-пам-пам.
patient goes to a physician and he acts as a control officer, as a dispatcher. He sends you to the surgeon or to some other doctor. So a couple of years I was in a village in France. My fellow classmates actually moved to France, and so they had a Dutch country house there, and my friends took me to the local hospital, so everything is quite simple. But even in such a village,
Ну, каким
they arranged it that
не задумывался.
I could do some checkup there quite easily. When I deep dived into that problem, I saw that the mentality is different among our doctors and our patients. Probably this is why people are not opting for physicians, because the payback is lower, and probably we will change the mentality and not just change the infrastructure.
Я о другом.
Well, let me tell you something else. This is about a civilizational process. For instance, if we take a period prior to the pandemic, when traditionally a person falls ill, he goes on foot to the hospital, he has to stand in a queue. But now, a person may make a phone call or through some other communication systems may inform a doctor that he fell ill and he would be administered certain pills. So the number of people who are coming to the hospitals or clinics on foot is going down. So even the elderly understand that it's much better to save up time and not to stand in a queue.
Если взять вот это
Well,
цивилизационный процесс, мы постепенно
again, we are
маршруте
changing this attitude. The lean processes have to be implemented. All these processes which have been offered by the ministry have to be supported. And people understand that situation. They feel that it is more convenient for them. And they are giving up the stereotypes. Thank you so much. Yes, please. Well, to follow what
Я просто
Mr. Khabirov said, let me just share some statistics and some facts from Bashkortostan. If we look at the number of
на 3 приема в Башкортостане.
patients in Bashkortostan, so there is one
Что в остальных?
research per 3 patients. So what doctors are doing in other cases? Well, the doctors are executing certain statements or executing sick leaves. So it means that they are treating only every 3rd patient. And it means that this is the job which can be done by other people. What is going on in Bashkortostan, for instance, is dramatically different from the same impression in other regions, because Bashkortostan, in terms of
Все-таки
urban rate, is in the first half of the resources allocated. To our surprise,
работаем. Увидели следующее обстоятельство.
in Bashkortostan, we saw the following. The key pressure on the system
Процентов населения со средним
is made by 20% of the people with
20%.
age over 40 years. So it means that these 20% of patients come to see a doctor 5 to 7 times a year, whereas the rest 80% of people see doctor only once a year. So it means that we have to change a law which will help us to transform the telemedicine in the shortest period of time. And until we streamline the digitalization, we should not ask for public money. I think that this is very important.
Сергей Александрович, давайте я дальше.
Then, Sergey Alexandrovich, I'll give you the floor. There's a question that interests many. Paid or unpaid? medicine. The government now has a lot of initiatives in this field, all the federal bodies and everybody who is connected with the state. So they should understand the person they are dealing with and seek the most convenient solution. And the question is, can we then more actively use paid or private paid medical services in order to keep the quality higher? Or do we need to have the same quality everywhere? What would you say? Where are the borders between the paid and free medical care? In one region, I'm not going to name it, a person I know was flying to Moscow, felt unwell. In the evening, he had a stomach ache. In the morning, he called a private clinic. He had an acute pain, and they said, "No, with acute pain, we cannot treat you. You must go to a state clinic." And so he called a state clinic, and they didn't want to deal with him. But later they find out they flew him to another clinic where it was discovered that he had appendicitis. And perhaps if private clinics were allowed to do such operations, he could have had medical assistance much quicker. Well, I would like to dispel certain myths. If all the medical facilities are created on the same are trained in the same way, and so they live in the same state. So why should private medicine, which is provided for payment, be better than free medical assistance? But our constitution provides for the citizens to get free medical assistance in a state municipal system. And I spoke to members of the Constitutional Court, and they said that this is one of those provisions of the constitutions which may not be changed. So if we interpret it, so any person who comes to the state or municipal system of public health must be able to get any medical assistance, no matter how much it costs. And so we are hostages of this situation, because if we speak sincerely, the free medical assistance must not have any borders. But what happens in the mental state of society? If we look at the statistics, we'll see that private medicine is growing as regards its turnover 45% every year. So people who can pay are now disappointed with free state-provided medicines, and so they have migrated to this private system. And these people must pay more. These are about 5 to 7% of the population, and these are the richest people who must pay more taxes, so that there would be more money to make the state-free medicine better. I have traveled all over the country, and there are certain centers to which population wants to go to from all over the rest of the country, like Moscow, St. Petersburg, Perm also, and also perhaps Bashkortostan, etc. So Moscow is very different from the rest of the country. In Moscow, you can build anything, but as soon as you cross the Moscow circular highway, things are totally different. And so a good doctor 10 will migrate from the provinces to Moscow, St. Petersburg, or other immigration center, because here can find the, for example, in Kashtim, we cannot hire really good doctors because they demand too high salaries. They want to receive 250,000 rubles per month. That's what we have seen there. That's another limitation of the system. So we have no qualified human capital in public health, because all good doctors want to go to immigration centers. And the second limitation, the money that we manage to get into the fund of medical insurance is a limited sum. It is everything that we can spend on medical health or medical assistance in state-run clinics. And I feel pity for people who manage these funds, because new equipment, new technologies, new medicines cost a lot of money, cost more than old ones. And where do they can find it? And the infrastructure is horrible in some places. There are some wooden buildings which are all rotten. I have seen an obstetrics and first aid health center which was last refurbished in 1948. So how can people find medical assistance in good conditions? So it is dramatically necessary to cardinally change the system of public health and to introduce competition. And what sort of competition? First of all, economic competition. Article 35, paragraph 7 of the law on the federal medical insurance does not allow more efficient organizations to get more money. And we need to change this. Though better organizations, those that provide better medical assistance, must get more advantages, more money, so that they could reinvest this money. It is absolutely clear, it is normal, and it is not demotivating. And the second point is transfer of payment, so that people should not pay not for the amount of medical assistance, but for the quality. We should assess the quality of medical assistance, and if it meets the necessary metrics, then it will be rewarded, financially rewarded. Then we will have better medical institutions, which will get better funding. And a quick victory is disclosure of information on the quality of medical assistance. In the city of Moscow, not a single medical facility discloses the data on its on the quality of its of the treatment it provides. For example, if people find out that Kommunarka hospital provides better treatment, then people would want to go there, and so it will get more money. And the last idea, which I try to promote, the country has no money to allow infrastructure projects. There is a private business which has enormous resources. The financial system which has enormous resources. I would suggest doing a simple thing which exists in other industries, to place a long-term state order for investment, so that large-scale business would build infrastructure, large-scale infrastructure, getting money based on the pre-established tariffs, which is easily calculated. It's a simple solution, and the business would be happy to do it. And if you provide 15% within the tariff, then the large-scale and medium-scale business will construct a lot. Because the medical business in the state is very active, and so we can win very easy, simple victories, which would be won within 3 years. Yes, I have listened to Sergey, and I would like to say, as regards publication of the results of quality, and etc., I'm not sure that the clinics within the group publish the results of their quality. And it is really difficult to give advice to others when you do not do it yourself. When I spoke about an environment without borders, it is a global, open system. This system must be open to patients. The question of ratings and assessments is very complex. The example with the Kommunarka hospital, everybody knows that Kommunarka is better on certain points, and everybody knows that everybody went to Kommunarka, and it became overcharged because everything has its limits. It is very important here to understand that our resources are not unlimited, and we cannot build a tent city to create long queues for various tests, etc. We need to prevent medical facilities from being overburdened with patients. In reality, even before we start paying for results, showing the objective results must be here. And indeed, in many countries of the world, there are examples of publications, open public information on the activities of institutions. But they must be objective and not subjective, like just likes on the websites. Patients' reactions are not always objective. A smiling doctor is not always a good doctor. And of course, we will need to use the resources that there are, private, public. We really need to concentrate as regards all the resources. And that's why I support Sergey. We should all fight together so that we could win together. We will win together. It is a trite phrase, but it is true. Only then can the state overcome all problems. I would like to support Sergey. Over the latest 5 years, we have seen that the investments in public health in the Russian Federation are much higher have been growing much faster than investment in all the other industries. And the state works a lot in this field. We have seen this in many areas. And people work very actively here. And I would not say that the people, the consumers of those systems are not the 5 to 7 or the people, the customers of private clinics are not limited to those 5 to 7% of the population. In fact, very many people, even poorer people, go to such clinics, and we have now a parallel system And I believe that we have a soldier system, and people who earn more than a certain amount of money, they could pay more into the medical insurance system on condition that this money would be used effectively. And we must understand that not people should pay and vote with their money, even including people who do not have enough money for this. Perhaps we should not raise, we have transferred to the progressive system. We should solve this question. But I would like to ask you, to ask the Deputy Prime Minister, Mr. Zelensky, where do we find the money? Well, all the money that the state has, all that those 5 billion are tax money. An opaque system of taxation an opaque system of public health will never be able to gain the trust of taxpayers. We are now increasing taxation, which is not the best way. Perhaps we should learn other ways of using the taxation money so that it would be more efficient, like, for example, telehealth, etc. Of course, we should we should have additional money. There is no ready-made solution. And I would like to say that we should all act. The regions must allocate certain resources. At present, now, all the most organizational powers in the field of public health are regional, while the medical insurance powers are delegated to the regions on certain points. And there should be something, and there should be differentiation, and we need, but the investment money is also, investors' money is also important. And not just private clinics, but also state-run clinics. So we have 5 trillion rubles per money, 5 trillion rubles per money per year. This is a lot of money, and even with this money, we can do more. It's a colossal figure. It is comparable to social security money or defense, money spent on defense. It's a monstrous figure, and we need at least to show what we have done using this 5 trillion rubles. We have discussed. We have mentioned that 70% of infrastructure is now wants refurbishment. So we should focus on the most important problems and to work on it. We should think of possibility of using private investors, because it would be very hard for the state to find additional billions or trillions of rubles. So we must have a possibility to look for external resources, and then this system being effective will guarantee good yields on the invested money. And I would like to support Denis Nikolaevich. We must invest in personnel, in medical personnel. 80% of obligatory medical insurance is the salary of medical personnel. and the salary must be worthy of their work. So you have mentioned personnel, and I would like, by way of wrapping up, I would like to ask Dmitry Nikolaevich, as a governor, what is your experience connected with the burnout of personnel, turnover of personnel, or personnel leaving their place? So people say brands give promises and people keep those promises.
A doctor has to be a good one or a smiling one. So if it is a mid-range doctor, he has to be good enough and smiling at the same time. How address this problem? Well, everything is important. And the key question is the compensation rate. And then it is followed by the convenient and decent labor conditions. We have to offer housing and the career growth perspective. This will give us an opportunity to invite more people to healthcare system. Last year, we launched our regional project, which is called Personnel for Medicine, for healthcare. It was the rural doctor and rural paramedic program. What else we're giving? Actually, we are working in the 18 municipal entities with the biggest shortage. Up to 2 million rubles a doctor would get to improve his housing conditions if he moves from the city to village. In the cities and towns where the pay rate is quite high and therefore the paramedics are not too eager to work, we offer 10,000 rubles per month to help them rent a flat. And every year we're going to launch 5 classes for school children to study healthcare, to study medical science. This will help us to popularize the profession. Targeted medication, targeted training of the people in the medical institutions and vocational schools. This is what we're doing. We have some targeted students in these universities, and also spoke about re-equipment of our basic medical university. We are building a dormitory for the students. We are working very closely with the companies, with the enterprises, who now understand that they have to invest into the healthcare. The enterprises and companies are building private flats, private houses, and they are offering that to the doctors who are working nearby. We understand also that we have to improve the image of the profession. This year we launched kind of a contest following the Leaders of Russia model. We invited 100 of our specialists, and I hope that Sergey Notov will come to us to read lectures about the economy of healthcare. There will be more speakers to attend this contest. But we are training the people for everything, so that they would have some basic knowledge of economics, of healthcare, etc. In 2024, we will totally resolve the problem of shortage of doctors and nurses, so that people not only opt for that profession, but also stay in the profession. And it is also quite important that they work on the new equipment. We have to build new polyclinics and hospitals. And most importantly, we, with no exception, have to gratify the doctors for their work. I would like to associate myself with what's been said, that Thank you, the doctors, for being with us because they save our lives and they save our health. Thank you so much. Difference. Well, we are running out of time, but we have about 10 minutes because we started a bit late. I'd like to arrange another discussion. Well, sometimes people say that if you don't have any data, then you're managing nothing. Digitalization is a question of the internal digitalization of telemedicine and using all the modern technologies. And this question is quite relevant. I have a very interesting experience myself. This is a smart ring with lots of sensors. The best sensor in the world. I will not advertise the company that manufactured that. And for instance, if I'm asked when I go to bed, I try to go to bed about 11:30 p.m. I try to actually go to bed before the midnight, but my ring told me that I'm going to bed midnight. And for instance, using that information, I try to treat very responsibly to what I'm doing. Just starting from 10:30, I try how to make sure that I go to bed earlier. Technologies advanced a lot. And in health, the technologies are going on much faster. What are the main barriers? What we have to do as a priority, for instance, personal data, disclosure of personal data, for instance. I can imagine that we have one unified database and everyone has access to that. It would generate a lot of risks. Well, I do think that we have to do enforcement more bravely, more courageously. Telemedicine bill was submitted for consideration even before the pandemic. But Vladimir Zelensky and others said that there were lots of barriers. And now, as far as we couldn't address this problem before, we couldn't actually implement the experimental sandboxes. So we could use that as a test site. These things can work very well. And at the same time, it will contribute to more investments. The laws, efficient laws that would regulate this area, this is something that we have to do. Well, and we do have to have more pilot projects, I think, colleagues. Let me share my brief comment to pick it up from what's been said by Mr. Farrakhov. Well, we have a competition from Dr. Google. Probably the ring tells you that you actually are going to bed midnight because it has a wrong time zone. So it means that every technology implies that you have to be able to use that technology and you have to be wanting to use that technology. Many people are afraid of the artificial intelligence in the sense that more doctors would become redundant. That technology has to complement, has to assist, and we don't need this technology not to bring together all the data in one database. This is not an objective per se. Patients, doctors, clinics, and managers have to be able to exchange data to speak the same language, digital language, that we don't have to upload any paperback reports. The data is generated once, and this data should be used by the people who need that and in the scope that is needed for that. I think that we have actionable data term. So this is the data that is needed in order to take some specific decision. Otherwise, we'll make some big database which would be totally useless. The technology should not become an idol, meaning that we boast having a telemedicine, but what matters is what result it may give us. Let me repeat. The question of culture of correctly using this data and technologies at all the levels, starting from patients and doctors, ending with the ministry and regional authorities, and the mandatory insurance system. We have to exchange the data that we need, and we have to take the data that we have.
Никак, да.
That's about the support. That's about the support of all the stakeholders of the system, not just an objective, not an abstract goal. And again, bearing in mind the shortage of financial resources. Well, I think that in 5 years' time,
Мне так кажется. Или я...
X-ray won't be needed.
Нет никакой самоцели, Владимир.
Well, this is not an objective per se, to use that technology, not to use that technology. There are dozens of technological solutions which may improve the quality of healthcare, and it makes it easier for the doctors to work, and it makes it more convenient for the patients. I drew some examples from Ivanovo district, and I think that other regions also have some best cases. We have to adjust the regulation. Promotion of technologies is not an objective per se, but there are some areas where telemedicine may benefit everyone. All in all, I'd like to tell you that last years have not to be neglected before the pandemic. We had a sustainable trend to increase the lifespan. A lot of very good has been done, but the pandemic highlighted lots of issues and problems and questions, but also offered some opportunities to transform our healthcare system. I think that on such a note, let us conclude our session. So we are celebrating the old-style New Year. Just several wishes from your side, or just common vision. How do we move forward? Well, it's been said that we have just to do something. So the most important thing is just to make sure we do what we have discussed today. Despite the difficulties, we have just to make sure that our healthcare system is really capable and of doing everything. It has all the necessary potential to be in the top ranks. And we do have money. Well, we do have money. And I do think that we will get more money eventually. Mr. Protsenko? Well, if we have money, if the heads of the regions, if the doctors, the lawmakers know what to do, there are some impediments. We are impeded by the pandemic, so just take a jab, take a booster vaccine, and follow the recommendations of the doctors. And I wish you happy old-style New Year. Mr. Khabirov? Well, I'd like to take advantage of that opportunity to tell you that we have to thank our doctors and nurses continuously, because they are at the forefront of our battle against the pandemic. And in our republic, we actually say that 41 doctors died in this battle, in this war against COVID-19, but other questions that we have discussed, this is our duty, this is what we have to do, and we have necessary money for that. The comprehensive program, this is the proposition by the president, and it's full of money, and 18 billion rubles have been allocated to the Republic to improve its first aid and primary aid system. healthcare is about the people, and we managed to stand that first blow, first strike.
Здесь
Well,
дипломированных профессионалов.
Mr. Farrakhov, well, there are two
Чрезвычайно приятно,
professional doctors among us, and I'm very much pleased that
настолько профессионально,
such people
не просто
are so much professional that not only they discuss the healthcare system, but
совершенно хорошие предложения,
they offer some very good
понимание роли врача и роли отрасли вообще.
opportunities and understand the role of the state. So it means that the industry has a huge potential, and this potential certainly has to be used.
Лишний раз хочу сказать,
And once again, I would like to reiterate that I'm very much pleased that
здравоохранение впервые, я думаю, за всю историю здравоохранения заговорил.
this is for the first
Это я
time that
важный,
a representative of the healthcare ministry spoke about lifting the barriers
использовать те резервы,
to use these reserves that we really have. Otherwise, our efficiency in our reserves would be
Мы говорим о медицине, я, конечно,
lower.
желаю, конечно,
Speak about medicine, I would like to
здоровья,
wish all our people stay healthy and to
особенно с точки
treat your health with more caution. Doing regular checkups,
зрения, я убежден,
checking with the specialized doctors. Although I'm not a professional doctor, I believe that it will help us to
экстренной медицинской помощи.
resort less to the emergency medical system, to the ambulance. And therefore, we will be able to provide more high-quality assistance. Thank you.
Знаете, я начал сегодняшнюю встречу
Well, our today's meeting, I started with the
умножение населения России.
quotation of Lomonosov that we have to multiply the people of Russia where we are now.
Промышленной революции.
That's the stage of the fourth
5-40 лет
industrial revolution. Every 40-50 years we have another industrial revolution, Industry 4.0.
цифровизация.
And in the future we have to expect digitalization, healthcare and biochemistry.
То, что сказал Владимир Анатольевич, открытость данных,
What Mr. Zelensky said, openness of data
децентрализованная
is not possible without digitalization. We
цифровизация.
actually need digitalization to collect data. We have to understand the path of our clients, and this is not possible without digitalization again. So the key factor
Все-таки на сегодняшний день признать
for Russia to stay in
сосредоточиться
top, and we have to focus this year and next year on bringing together our efforts and our competences in the area of digitalization, because
наших людей.
it accounts for 50% of our success.
Ну, я тогда хотел бы
Well,
закончить, наверное, с того,
And I would like to conclude with what I started with. The President put forward an objective for all of us. 78 years of average lifespan in Russia. And I do think that all the people would support that objective. And
продолжительность.
every year of pandemic has to contribute 1 year more in terms of the lifespan. And it depends on our first aid and primary aid system.
Структура и финансы.
It would require improvement of the financial system, of the infrastructure. We need more people, retaining doctors, developing doctors. Within these 90 minutes, I think that we tried to discuss these questions. Thank you so much to all the panelists. I'd like to thank the doctors. You are helping us a lot, and I wish you to stay healthy and wish you a happy old-style New Year. Thank you so much.